Hello everyone and welcome. Today, we're diving into a less common, but increasingly relevant urinary system disease, ephedrine stones. We'll explore what these stones are, what causes them, and how we can manage them. Let's begin with the etiology. Ephedrine stones are primarily caused by the chronic use or abuse of ephedrine and pseudoephedrine, compounds found in some over-the-counter decongestants, weight loss supplements, and even performance-enhancing drugs. These substances, especially when taken in high doses or for prolonged periods, lead to increased urinary concentration of ephedrine and its metabolites, creating a supersaturated environment within the kidneys. Now, how do these stones actually form? The pathophysiology is relatively straightforward. Ephedrine and its metabolites, like meta-hydroxynorephédrine, are poorly soluble in urine, particularly at higher concentrations. When urinary pH and ephedrine levels combine in just the wrong way, crystals begin to nucleate, forming tiny seed crystals. Over time, these crystals aggregate and grow, attracting other substances in the urine, eventually forming larger, clinically significant stones. The stones are typically composed of ephedrine or its metabolites alone, or in combination with other stone-forming minerals such as calcium oxalate. Turning to the epidemiology, ephedrine stones are considered relatively rare compared to more common types like calcium oxalate or uric acid stones. However, their incidence is likely underestimated due to underreporting and misdiagnosis. The prevalence is higher in populations with easy access to ephedrine-containing products and among individuals with a history of stimulant abuse or those self-medicating with over-the-counter decongestants or weight loss aids. It's especially pertinent in individuals who exercise intensely, as dehydration further concentrates urine. What are the signs and symptoms? The presentation of ephedrine stones mirrors that of other kidney stones. Patients may experience severe, colicky flank pain that radiates towards the groin. Other common symptoms include hematuria, or blood in the urine, dysuria, or painful urination, urinary frequency and urgency, and nausea and vomiting. In cases of infection, fever and chills may also be present. It is important to note that smaller stones may be asymptomatic and only discovered incidentally during imaging studies. How do we diagnose these stones? Diagnosis typically involves a combination of imaging and urine analysis. A non-contrast CT scan of the abdomen and pelvis is the gold standard for detecting kidney stones, regardless of their composition. Urinalysis can reveal hematuria and may identify crystals suggestive of ephedrine or its metabolites. Further analysis of a past or surgically removed stone through infrared spectroscopy or X-ray diffraction can definitively confirm its composition as ephedrine or its related compounds. There aren't specific classifications or types of ephedrine stones in the same way as there are for calcium oxalate or struvite stones. They are generally categorized based on their location within the urinary tractus, kidney, ureter, bladder, and their size. Moving on to treatment and management. The approach depends on the size and location of the stone, as well as the severity of the patient's symptoms. For smaller, asymptomatic stones, conservative management with increased fluid intake and pain relief may be sufficient. Larger stones or those causing significant obstruction may require more invasive interventions, such as extracorporeal shock wave lithotripsy (ESWL), rotoscopy laser lithotripsy, or percutaneous nephrolithotomy (PCNL). It is absolutely crucial to address the underlying ephedrine use or abuse. Education, counseling, and in some cases addiction treatment are necessary to prevent recurrence. Can we prevent these stones? Absolutely. Prevention hinges on minimizing ephedrine intake. This includes carefully reviewing the ingredients of over-the-counter medications and supplements. Individuals who have a legitimate need for ephedrine-containing medications should use them sparingly and under the guidance of a healthcare professional. Maintaining adequate hydration, aiming for clear urine throughout the day, is also crucial. For those with a history of ephedrine stone formation, monitoring urine pH and considering potassium citrate supplementation to alkalinize the urine may be beneficial, but requires careful medical supervision. Finally, let's discuss the prognosis in recent research. The prognosis for individuals with ephedrine stones is generally good, provided they address the underlying cause of ephedrine use and receive appropriate treatment. Stone recurrence is common if ephedrine abuse or inappropriate use continues. Recent research is focusing on developing more specific assays to detect ephedrine metabolites in urine, improving diagnostic accuracy. Furthermore, researchers are exploring novel drug therapies that could potentially increase the solubility of ephedrine in urine, thereby reducing the risk of stone formation. Ongoing surveillance of over-the-counter medications and supplements is also essential to prevent future cases.